Hey guys, my name is Dr. Epling. We just finished up an awesome Tuesday training, and before we ended the day, we wanted to make sure we get a video out to you guys explaining a little bit more about the adjustment process and what's all involved in an adjustment. So the first thing we do in our office is we want to make sure we're taking x-rays of the patient so that they get a full understanding that we're adjusting to that specific patient and to their specific condition. So as you can see with the patient that we have here, I have her x-rays up for the sake of this video so you guys can actually see specifically what needs to be corrected, and that's kind of how we base our adjustments. So I'm always writing down exactly what is going on with them, and that's according to how we adjust. Now each and every visit may be a little bit different depending on their activities the previous day or if they've had any other issues or ailments that may have come up from that. But generally we're adjusting according to these x-rays for that specific condition or patient. So with regards to getting an adjustment, the first thing we always think of is an adjustment's just for pain. So with just pain, chiropractic is great, but we're not just about pain in this office. We're more about function and increasing the overall health and healing of the body. So for this patient here, the first thing I always do before I adjust to anybody is I want to check and see what's moving, what's not moving, what is tight, what is not tight, if there's inflammation. So that's going to be the process that I use first. So I'm always starting low back, and we just kind of move the spine, see if there's some springiness to the spine, if there's something that's stiff or something that may be hurting the patient. Also, I'm checking for inflammation around the joints. And then also the muscle tightness or tension on either side of the spine. This helps me to provide a better and more specific adjustment for this patient for the day. So I'm going to have you put your right side up. Now we're going to do a hip adjustment to start. Her right hip is dropped down, so what we want to do is make sure that we work on pushing that hip upward. So for a hip adjustment, it's not painful at all. As a matter of fact, most patients would say that it's more relieving, if anything. So in this case, have the patient lay on their side, put their leg up, they put their hands across just like this. Now what I'm going to do is put my leg over. This just allows me to put extra tension on this hip. I'm going to put my hand directly where the right hip needs to be. I'm going to lean over and apply the little thrust. Now I'm going to have you flip over to the other side. Being that the hips are connected, you want to make sure you're adjusting both so that they're both moving properly and correctly. So let's switch those there. Good, just like that. Leg goes over, hand here. Awesome. And I'm going to have you lay on your belly. Now we're going to do a mid-back or a thoracic adjustment. A lot of patients tend to have issues in their mid-back. This is a transitional area, especially for women. They usually have bras, and it puts a lot of tension. It restricts motion in this area. So the first thing I want to do is just check again for muscle spasms, for tension, for loss of mobility. All right, and then I'm going to have you take a deep breath in. You're going to blow it all the way out. Relax, I'm going to put pressure. Awesome. One more time. Breathe in and blow it out. Relax. Good job. Okay, so that was a thoracic adjustment. Now, again, with our adjustments, it's not just about pain, as I said. We tend to focus more on the function of the body. So for the low back, it can help with things such as bowel issues, bladder issues, reproductive issues. For the mid back, you're looking at things for pancreas if you have issues with blood sugar or insulin, blood pressure, things of that nature. And then in the neck, again, obviously for neck pain, but numbness and tingling in the arms, thyroid conditions, eyes, ears, nose, throat, sinus issues, definitely headaches and migraines. That's a huge one that we see great results with in the office. So now I'm just checking her upper mid-back or lower neck area. And so what we're going to do is put a little bit of pressure right here. I'm going to turn her head away and put some pressure there. And then we're going to go the other way. Awesome job. Now in my office, I use something called an arthro stim. Arthro is joint, stim is stimulator. Essentially what this does is it taps repetitively, and this provides extra motion to the joint, and it allows us to get motion in each individual joint specifically. So we're going to start in the low back, and I'm going to work my way up. Most patients love this because it doesn't hurt. They actually say that it feels more like a massage. And what it does is it helps to increase what are called mechanoreceptive function that the brain will pick up and sense and help to decrease muscle spasms and pain, and more importantly, increase mobility in that joint specifically. And also you use this to correct curvatures that are in the spine or with specific segments that may be rotated more than another one. This can actually help correct that over-rotation. Awesome job. All right, Miss Adalian, I'm gonna have you sit up in the chair for me, please. Now we're gonna do a neck adjustment. A lot of patients or a lot of people always ask questions about the neck, and they're like, I've heard, a lot of crazy things about the neck. Does it hurt? No, as a matter of fact, it doesn't hurt. And this patient's been adjusted several times, so her neck is more used to moving. But with the first adjustment, I always explain everything that I'm going to do, and I'm checking for mobility here to make sure that everything's moving, what's not moving, what's stuck. And so right here in her lower neck, she's definitely got some restriction down here on this right side. So what I'm going to do, I'm going to take my hand, I'm going to drop her head to the side and pull up. I didn't turn her head really far, I didn't pull really hard, and we got the release and the motion that we wanted to get out of that segment. And then we're going to also check over here, and she's got one in the upper segment. This is typical to cause headaches or a lot of neck pain or stress and migraines even in some cases. So nice job. Then I go back and I just double check, make sure everything is moving well. Good, awesome job. And then again, we use the arthro-stim for curve correction in the neck, especially with posture these days. A lot of people have a lot of the forward head posture and loss of that C curve, so this is going to actually help to restore some of that. So we just put light pressure on the neck. Make sure to open up those upper segments near the brainstem, and then we take their head and have them look all the way up, and we're just forcing that curve in their neck as well. Awesome job. Power's on. Good job. Nice job. So now that we've done her adjustment, she's feeling great. She's going to go on and do her therapies and help to build and adapt the muscles around the segments and the joints that we just got adjusted. And for you, if you have any questions, or even more importantly, if you want to know more about the adjustment process and what's going on with you and maybe some symptoms that you're dealing with, we've actually come up with a special for you guys that have been watching these videos. $49 will allow you to get a full consultation exam and any x-rays that are needed. And as a matter of fact, we've now thrown in the first adjustment with that price as well. So you have about 2 weeks. If you want to give us a call, 919-785-9191 is the office number. One of the girls will be happy to help you. Have an awesome day. We'll see you next week.